Hi everybody, checking in. I am now 3 days post-op and I am home. I'm so glad to be home. I took a nap earlier in my own bed and it was glorious. I think it does help that I have a Tempur-Pedic adjustable bed, so it was a lot more comfortable than sleeping flat in the hotel bed last night. So I just wanted to check in. I have not weighed myself yet, and I told my husband to hide my scale because I don't want any fluid retention to impact the number I see and have it sort of disappoint me. So I think that is a good strategy. I've sort of read a lot of message boards throughout this process, and I think that it's a good idea for me. So something to think about if you're pre-op still. My husband's been very helpful. He, is helping so much with the baby. I can't lift him, and just letting me rest. So, and sort of getting me water when I need it and getting me a popsicle. So he's been really good. I just wanted to recap the last few days. I know before my surgery, I read as much as I could to see sort of what the experience is going to be like. And everyone's experience is different. Everyone's surgery, everyone's surgeon, everyone's hospital is different. But so this is just my account, and yours, may be different. But at least you sort of see how it was for me. You can see how it was for other people and get an idea of what to expect. So, I traveled out of state for surgery, and so this sort of applies a little bit more, I think, to people who travel for surgery, whether it's out of state or to Mexico or wherever. My surgery was scheduled for Monday, and I flew into Florida on Sunday late afternoon. By the time we got to the hotel, it was probably 7 o'clock or 8 o'clock, because we had to get some things from Walgreens and pick up some stuff to have for me to have post-op and for my sister to have with Lucas while I was in the hospital. So I checked into the hospital Monday morning at 8:30, and they took me back into like a little holding area. The lab took some blood, and then I just got into a gown and I waited. I talked to my anesthesiologist first, and then I talked to my surgeon. I couldn't have anything to calm my nerves until after I talked to both of them because they wanted me to remember, and I have to sign some paperwork and stuff, and they wanted to make sure that I was coherent for that. So basically, as soon as the anesthesia tech came in after I talked to my surgeon, I asked about getting something for my anxiety because I was really feeling very nervous and emotional, and my surgery wasn't for a few hours yet, and I just didn't want to sit there and just be so in my head and nervous. So he brought me something, and that made me really loopy. I did post a video of me while I was taking it, and it's kind of funny. I said I felt like I was drunk, and I just feel like I was pretty silly in the video. So if you want a good little laugh, go ahead and watch that video. After that, I don't remember very much. I vaguely remember being rolled into the operating room. I don't remember being moved onto the table. I think at that point maybe they gave me the good stuff to knock me out, but I don't remember. Normally I think you put on a mask and you breathe in to knock you out, and or maybe they put it in my IV. I don't know. I don't remember that at all. I just remember sort of vaguely. I don't remember even being rolled into the operating room. I just remember like laying on my bed in the operating room and like was about to be transferred onto the table. So, and then I woke up. I don't even actually know how long the surgery was. I forgot to ask because they did do a hiatal hernia repair, which I knew about. But when I woke up, I was in actually quite a bit of pain. And I had a tube in my throat, so my throat was really raspy and I couldn't talk very well, but I was in a ton of pain and I was really nauseous. And I think that's normal because they don't preemptively medicate you. They don't know how you're going to be feeling, and they don't know exactly when you're going to wake up. So my nurse wasn't like sitting right next to the bed when I woke up, and I was sort of just like hollering, but not really, because I was like whispering and it felt like it took forever for someone to come and put some medicine in my IV, but it probably was literally like 2 minutes. Like it was just really, really painful, and I was just like, oh my God, what have I done for just this brief second. Once they gave me the medicine, I was just sort of resting and in and out of sleep. My sister and my son, Lucas, came in, but since it was the recovery room, he couldn't be in there because he was a baby. My sister brought me flowers, and she couldn't have those in there either. So I just told her to go back to the hotel, and I'd let her know when I had an actual room. For whatever reason, there was like a fluke and they did not have a bed for me. And I was in that recovery room for like 8 hours and it was miserable. I thought, oh my God, this is going to suck if it's 3 days like this. Cause there was other people in the room. It was like not quiet. It was bright. I did have a morphine pump to help with the pain, but I didn't know how often I should use it. Like I was afraid I was going to use it too much, which apparently there's like built-in settings so that you can't overdo it. So yeah, so I waited there forever, and that bed was really uncomfortable, and I was sore, and so that was probably like the worst part. Right in the beginning was just waiting so long for a bed. And also the biggest tips that I got, one of the biggest things was after surgery is walk as soon as you can get up. And they wouldn't let me walk while I was in the recovery room. They wanted me to wait until I was in my room and had, like the bariatric nurse team there or whatever to go over stuff with me. So I didn't get to walk until I got to my room, and it was probably like 8 hours after my surgery. And I was really bummed because I was like, I just wanted to walk. My nurse was really excited that I wanted to walk because she said she usually has to like really push people to get out of bed and walk early on. And so it was kind of funny. She said, oh, I wish all my patients were like you. It's kind of cute. Oh, I need to sip. So sipping all day long. It's really hard, actually. So anyways, so I get into my room. I go for a short walk, and I'm just resting. The first night I couldn't eat or drink anything. I don't think I could even have ice chips. I don't remember. Maybe I could have ice chips. Yeah, just some ice chips. And so the first night I didn't sleep very well. They woke me up a couple times to draw blood and to give me some medicine. And every time I woke up, I just gave myself a little pump on the morphine to help me go back to sleep, and wasn't really in too much pain. My incisions weren't bad. I do get little gas bubbles after I drink, even if I try really hard not to swallow any air. So it's kind of annoying. So I apologize for that. So I wake up the next morning, and I was allowed to have just ice chips and I was allowed to sip room temperature water. They said cold water could cause like a contraction in the stomach, and it would hurt, so I didn't try it. But ice water, since it melts and sort of trickles down your throat, it's not as bad. So sorry, I keep looking down at my notebook so that I don't go totally off track. So I wasn't really in too much pain from the incisions. I did have some gas pain. I could really just feel it in my chest. My chest felt tight. And so I knew that was the gas pain they expand your abdominal cavity to do the surgery, and some of the gas gets stuck in there and can go in your shoulder and in your chest. So I sort of knew to expect that, and walking helps with that. So, so I was up for a while, and eventually I had to go down for my contrast dye, and that was awful. It was... so they took me off my IV, and I walked to the gurney, but they rolled me down there, and the radiology tech, I guess I was doing really good, because she said, oh wow, you don't have your IV and you're walking around, like that's really good. But so she gave me this cup filled with liquid, and it was a lot, and I'm like, I didn't know how I was going to drink all of it. And so I started, and the nurse told me before I left, she said, they might try and rush you, drink it really slow. It's not going to taste good, and it's going to be uncomfortable, but just don't let them rush you, and just drink it as slow as you need to. So I was like just sort of taking really small sips as I was drinking it, and I was just like, oh my God, this is so awful. How am I going to finish this whole thing? But after like 10 seconds of sipping, she took it, and I didn't have to finish it. So I was like really happy about that. As I was doing the test, I could see on the screens the fluid going into my throat. And so like as it went through my esophagus, it was like this wide, and then it like got down to my stomach, and it was like so small. It was like this little like squirmy line that was really like, my doctor said that after surgery your stomach is the diameter of like a straw because it's so swollen. So it was just funny to see it like go straight down the esophagus and then just like trickle into the stomach in this really small thin line. But that was over pretty quick. But I will say I felt so nauseous after that test. As I'm standing there, they had to do like a before and after, just like a chest x-ray. And as I'm standing there waiting for her to do the after x-ray, she asked me if I was okay, and I'm like, I'm just so nauseous. Like, I really thought I was going to lose it. So that was like for sure the most like miserable part of my morning. But it was over pretty fast, and got on with my day. It's funny because I don't feel like I don't know what I did the whole first day. I wasn't super medicated. I don't think I used my morphine that much, but I just sort of like laid in bed, and I didn't read. I brought books, and I brought a movie to watch, and I had a TV, but I just didn't really do anything. I sort of got on my message boards. I read. I took a couple videos, but it just the day just dragged on, and I just didn't really feel like doing anything because I didn't want to move. I did take my walks. I was supposed to walk every 2 hours. I think sometimes I walked every 2 hours. Sometimes I walked a little more often. So that was good. My little pole that had my IV on it really sucked, so it's kind of hard to push. My last night they got me a new one finally. So my bed also broke. Like I had accidentally tried to drop it down, and there was a chair in the way, and then it like just never worked right again. Like it kept breaking. Like I would be laying down in it, and I would press the down button, and it would just go like straight back, and it hurt. So finally, after it happened the third time, like the night nurse like worked on getting me a new bed, but it took a while, and in the meantime the bed was totally flat, and it was really uncomfortable to lay totally flat. I don't know why. It just didn't feel good. So after I finally got the bed, it was like midnight, and I was really tired. So I was just like laying there on the flat bed trying to sleep, but I wasn't comfortable at all. So that second night I got my new bed. The worst, so my incision pain wasn't bad at all, and I don't know if it was just like the morphine or whatever, but I had really bad gas pain, and it wasn't the gas pain that I expected in like the chest and the shoulders and stuff. I had gas pain like in my lower abdomen. So TMI, but I hadn't had a bowel movement since like 2 days before the surgery because the protein shake diet really sort of like backed me up a little bit. And so I just I couldn't pass gas, and it really hurt, and there was nothing really they could do. They gave me some Colace, it's a stool softener, but it didn't help. And so I could just feel like this rumbling in my stomach that really, really hurt. Like you have to go to the bathroom, but I couldn't do anything. I couldn't pass gas. I couldn't do anything. So that second night, since I wasn't hungry at all, but my incisions weren't very painful, but I was so miserable because of that gas pain. And at one point, I just felt this like wave of emotion wash over me. I know a lot of people go through like feelings of regret in the first couple of days, and I didn't really feel that. I knew that it was all temporary, but I was just this like, what have I done sort of feeling. Like, I don't know, I got really emotional, and I cried for the first time really about the surgery at all. And I don't know if I just needed to get that out of my system. I actually felt a lot better after I cried, but I was like sobbing, and it was just like, I don't know, it was kind of sad. After that night, my gas pains got a little better, but I still even now have some gas pain, so I didn't pass gas until I was on the airplane on the way home. So yeah, I'm still a little uncomfortable down there. I took some milk of magnesia earlier, so hopefully that'll help. Anyways, enough about that. Too much information topic. So let's see. So one of the hard things was taking medicine. The nurse that I had during the day on both the days I was there wasn't usually working on that floor, so I felt like she didn't really know what was going on. She was really nice, but like they had like a fluid catch in the toilet for my urine, and it would fill up, and I'd be like, it's full and I can't go, and she was like, oh, you don't need that, but then she wouldn't empty it. So I'm like, well, the first day I just found some gloves and emptied it myself, which I'm like, it's kind of ridiculous. I shouldn't have to do that. And the second day I just went to the desk and said, like, can someone please empty it for me and throw it away because I don't need it. So that kind of sucked. But anyway, so I had all these medicine I needed to take, and some of it was via IV and some of it was pills, and some of the pills were pretty small. Most of the pills were pretty small, but the first one that I took got lodged in my throat, or it felt like it was lodged in my throat, and it made me nauseous for like an hour, and it hurt. And so I didn't want to take any of the rest of my pills because it was just like in there, which by a tip, by the way, that my bariatric nurse gave me before I left is if that happens to just drink some like warm tea or something to help it just dissolve and get out of the way. So, yeah, but there's one medicine that I'm on for my blood pressure that makes me really sick to my stomach if I take it on an empty stomach. I would say I had like the epitome of an empty stomach at that point. And so I told the nurse that I'll take anything else, I'll crush it, whatever. I will not take that medicine on an empty stomach. So finally they like ordered it and gave it to me via IV. It makes me sick. Like it makes me nauseous, and sometimes it makes me throw up for hours. Like it's miserable. And I couldn't put myself through that. And I didn't want to risk it. So I was like, stood my ground on that one. She did crush some of the pills for me. And I just like mixed it in some Crystal Light because the second day I guess this must have been day 2 post-op because I had gotten like breakfast. And, oh no, I guess this was day 2 of the day I got discharged. And I mixed it in with the Crystal Light and tried to like sip it. It was so gross. The bariatric nurse suggested like just taking a little spoonful of applesauce and dumping it in and then topping it with a little more applesauce and then just taking like one gulp, which is hard to do now, but I think like within the next couple of days that'll be easier. So I've actually, like my Percocet that I'm taking now, I actually just like chomp it into smaller pieces in my mouth and swallow it quick with water because crushing it tastes so bad. It's actually just like less obnoxious and less disgusting to just do it. So, yeah, so my second night was fine. They woke me up a couple times again for labs and for blood, and for medicine. So I woke up on this would have been day 2 post-op, and felt really good. It was the day I was supposed to be discharged. So my doctor came in the morning and we just talked briefly, and he said everything was looking good and I should be discharged. So I was then just kind of waiting to be discharged. And my bariatric nurse I think she works for Dr. Shillingford, my surgeon, came in and talked about the post-op diet and what to expect. And I asked a few questions, like, because my post-op diet is really different than what I expected. So I'm actually gonna, like, as soon as I'm done with this video, record another one because this one's getting really long, so that way I can sort of break it up. But yeah, she told me to have a shake, like a little bit of a shake that night to sort of prep my stomach to have some solid food in the morning, which is, if you've done any research on post-op diets, it's really fast to have food. So I'll go over that in a little bit. Yeah, so I was just like sipping my fluids and waiting to be discharged. And my hand started to get really puffy where my IV was, and it was really tender, and every time she pushed any fluid, it stung like really bad, and it hadn't done that the whole time. And so I pointed out to her that my hand was really puffy, and she stopped the IV and went and got another nurse who looked at it, and he said, well, it might just be from, having it in for 3 days, but he pushed some fluid and saw how much it hurt, and I was like, maybe I'm just being a baby, but he's like, no, that's not normal. So I don't know if the IV slipped a little bit and wasn't in my vein, or if it was just leaking a little bit and putting some fluid in my hand. But they said, since you're going to be discharged in a couple hours, we'll just take it out. So I was nervous about that because I was getting all of my fluids via IV and then just like sipping, and I wasn't sipping very much because it's really hard to sip that much as much water as you're supposed to get. So yeah, so my IV was out, and I had talked to the nurse, the bariatric nurse, about my post-op diet, and then he just said, you can tell your ride to come in an hour, and called my sister and told her, and started packing up my stuff and got changed. And they took my pump out, or my drain out, and it was like stitched in. So I don't know why I watched this, but he would like clipped out the little stitches and pulled them out, and then he started pulling the drain tube out, and I didn't know if it was gonna hurt, and it didn't hurt. But I was expecting him to like pull it out, and it was like this long. It was seriously probably like at least 2 feet long, and he was just pulling and pulling, and I could feel it like sliding on the inside of against my skin or whatever. It was super weird feeling, but it was really bizarre to watch it come out. But that incision hasn't been too painful. My most painful incision by far is the one in my belly button. I don't know if that's where they took the stomach out. I've heard that incision tends to hurt the most. So the other ones are a little tender, but not bad at all. So yeah, so I got back to the hotel. I just rested. My sister took care of Lucas. They did come visit me my second day in the hospital, but my son just wanted me to hold him. He's 13 months, and I couldn't hold him, and he was getting really fussy. And I said, you know, why don't you guys just go back and enjoy your day, because I can't hold him, and this is hard for me, and it's hard for him because he didn't know what was going on. So yeah, so got back to the hotel. I took a shower, which was just amazing, glorious, wonderful, and then just had to change my bandage over my where the drain tube had come out. Everything else just had like steri strips on them that they said are just going to fall off on their own. And since I'm not going to have a 2-week post-op appointment, I can either clip my stitches and pull them out myself, or just wait for them to dissolve, which kind of stinks. Or I can go in and have them taken out, but I don't really want to pay like $200 for a visit because it won't be covered by my doctor. So I slept okay at the hotel, but it isn't comfortable to me. It wasn't comfortable at all sleeping flat. So, and like I said, I rolled on my stomach at one point. And my incision from the drain tube did leak a little bit. There was like a little bit of blood on the sheets in the morning. So, but when I took the bandage off, there was hardly any at all on the bandage. So I'm not sure, like, to be honest, like where the blood came from, because there was hardly any on the bandage at all. So, yeah, in the morning we had to get up at 5 to get ready to go to the airport. So my sister pretty much packed everything up the night before. I got really exhausted really easy. So even just lifting, like I have a 10-pound weight restriction, but lifting even like really small stuff really wore me out pretty quick. So yeah, so we got up in the morning at 5 and had to go. She had to load the car, and we went and returned the rental car. Went to the airport. I would say my number one advice, if you're traveling for your surgery, unless it's not feasible, give yourself an extra day. It's not fun being at a hotel when you're like post-op. It'd be nice to be home, but I was really, really, really exhausted walking through the airport, and I had a layover. So it was like, we get to the airport and we have our first flight, and then I have to walk, you know, to the next gate. And then our gate when we landed in Minneapolis was really far away from baggage claim, and you know, it was really, really, I was just so worn out, and I was really trying to keep up with the pain medicine. That's what the nurse said, to stay on top of your pain management. And I hadn't taken any pain medicine since like the day before, so I was like, oh, I don't know, I'll be fine. But it's a lot different when you're just like laying in bed and just walking up and down the halls versus like walking for like 15 minutes straight or whatever, and like getting up and down. So stay on top of your pain management, I would say, was really good advice that I didn't really take until it was sort of like I realized how bad it was. So but even then, my pain has not been that bad at all. I feel like I've done a really, really good job so far. Well, I haven't had that much to do with it, but my recovery's been really good so far. So I'm really happy that things are going good. And I'm sorry this video is so long. If you watched the whole thing, thank you for watching. And I am just going to record a shorter video now about my post-op diet. So I hope if you are still pre-op, just know, especially I think if you're on the younger end for this surgery, which I'm 32, and I think that is younger for this type of surgery. I'm also, my BMI I think was 42 or 43 to start with, which if your BMI is higher, 50, 55, you know, definitely do the surgery, but know that your recovery probably is going to be a little bit tougher. I think both my age and my low, but not really low, but BMI for the surgery really played a big factor in my recovery so far being really good. But I have heard it can get worse before it gets better, because I'm no longer like on IV fluid, so it's all on me now to stay hydrated. So yeah, so thanks for watching, and I hope if you have any questions, feel free to email me. My email address is triciasSleeveStory@gmail.com. And yeah, good luck with your surgery, and thank you for watching, and you know, it's great to be home. Bye.